This work is entitled Patient Safety in Undergraduate Nursing, Student Perspective. It was developed by the following authors. Patient safety needs to be addressed and discussed in a serious and responsible manner, where it is indispensable to equip future professionals to prevent adverse events and develop a culture of patient safety. There is a need to assess patient safety in undergraduate nursing in the context of classroom teaching and curriculum internships. This study proposes to analyze students' perception of patient safety at a university in the Northeast region of Brazil. This is the methodological path. It is a unique instrumental exploratory case study with a qualitative approach held at the University ASCES-UNITA in Caruaru, Pernambuco, northeast of Brazil. Participants were 12 students selected by intentional sampling. Data was collected by online focus group. Data were processed in NVivo software version 12 for qualitative research. The data processed in NVivo software version 12 resulted 3 categories that show a situational diagnosis of the student's perception about patient safety in the undergraduate nursing program at ASCES-UNITA. The resulting 3 categories are described and interpreted below. Category 1, Teaching and Learning Patient Safety in the Classroom. In this category, the topic was addressed in the knowledge constructed in the classroom with the positive aspects that students can apply to their professional learning. This knowledge consists of theoretical understanding, reading of didactic material, group discussion, and the abandonment of common content for critical thinking based on the most recent literature regarding the topic. It was always gradual. Patient safety content was addressed in all the thematic units. Student 13. We don't have a specific discipline on patient safety, but we learn about it throughout the undergraduate course with different teachers, not just one. It happened gradually. Student 28. Category 2, Learning Patient Safety in Curriculum Internships. At the start of curriculum internships, many students observed shortcomings in patient safety protocols at health units, such as their absence or partial application. In addition, the process as a whole proved to be deficient, with a lack of basic inputs, as well as the poor commitment of some professionals. In the statements below, students recognize the application of the content taught in the classroom with some reservations, such as the lack of continuing education and inter-team communication, resulting in the resistance of some teachers to following protocols. I've had experiences in places that don't follow protocols. Unfortunately, I see a huge shortcoming in the professionals and the institution because, in addition to not taking care of themselves, patient care will also be inadequate. Student 19. Category 3, Challenges to Implementing Protocols at Health Facilities. Here we can observe the application of patient safety knowledge by a future nurse. Regarding the difficulties found in implementing protocols at health units, the students frequently mentioned the resistance of professionals, the lack of interest by the managers, and the dearth of basic resources. Everything I learned was very important because when I arrived at the facility, I could detect errors and know which measures to take. Unfortunately, some professionals are unaware of these protocols. Student 1. For our final considerations, we have that the qualitative data analysis shows significant participation of students involved in patient safety, primarily in the context of classroom learning. In this case study, the university does not have a specific theoretical framework in the patient safety course, but according to the students, the topic is treated with quality in refinement, in theoretical knowledge, and in its application in either practical classes or in internships.